Alright everyone, so we're going to continue on and we're going to talk about mammography. So mammograms detect abnormalities in the breast, especially breast cancer. So for these patients, the breast is going to be positioned on the mammograph and compressed to flatten the breast tissue. 2 radiographs are taken of each breast from the side and from above. We're going to instruct those patients not to wear lotion, deodorant, or powders. For this test, there's actually no contrast media required. And we're also going to inform the provider if the patient may be pregnant. Okay. The next test we're going to talk about is cystography. So the purpose of this test is to view the urinary bladder for lesions or calculi. For these patients, they're going to be positioned on their back on the x-ray table. Their bladder will be catheterized and the contrast media will be instilled into the bladder through the catheter. And then the radiographs of the bladder and the urethra will be taken. So you can see in our picture that kind of balloon looking structure is actually our bladder. So for these patients, we're going to instruct them the day before to have a light evening meal. They may have a laxative in the evening and nothing to eat or drink after midnight. They're going to empty their bladder prior to the exam. As always, we're going to inform if they may be pregnant or inform of any allergies, and inform the patient there may be a generalized feeling of warmness when that contrast is injected into their bladder. The next one, hysterosalpinography. I know that's a long word, but this test is used to view the uterus and fallopian tubes for any blockage and lesions. This is also used to check for pelvic masses. For these patients, the patient may be placed in a lithotomy position on the x-ray table. The speculum is going to be placed in the vagina. A catheter is placed through the cervix into the uterus. And then the contrast media is injected into the uterus so that we can view the uterus and the fallopian tubes. For these patients, they're going to be given a laxative the evening before, a cleansing enema the day of the exam, no meals prior to the examination. They may be given some prophylactic antibiotics just in case. So prophylactic just means they're given it just in case they introduce any type of bacteria during the testing procedure, just because this is a very internal structure. Prescriptions for oral sedation may be given. Opening up the cervix is very painful, so they may be sedated for this test. And then they're going to inform the provider if the patient is pregnant and if they have any allergies to those contrast dyes. Okay, the next test is called an excretory urography or intravenous pileogram, IVP. This is used to visualize the kidney, ureters, and bladder to detect kidney stones, lesions, and strictures of the urinary tract. These patients are going to be instructed to empty their bladder. They're going to be placed on their back on the x-ray table. An IV is going to be started. Contrast media of iodine salts is going to be given intravenously after it's been determined that the patient is obviously not allergic to that iodine. Radiographs will be taken several minutes apart to observe the urinary function or the function of the urinary tract, and then the patient is turned in various positions to allow different visualizations of those urinary structures. So for these patients, we'll instruct them to eat a light evening meal, nothing to eat or drink after midnight the day of the exam. A laxative and enema are used to clean out the intestines to prevent blockage of the ureters, a blocked view of the ureters behind the intestines. Then we're going to inform the provider if the patient takes metformin for diabetes. This drug can interact with the contrast media, so we need to make sure that the doctor has instructed them to stop taking it for a bit while they have this iodine in their system. Inform the provider if they're pregnant or allergic to the iodine. Inform the patient that they may feel warm from the contrast media. And then after this test, we're going to ask them to force fluids to rid the body of the contrast media. So we'll see in our picture on the left-hand side there, we can visualize the kidneys, the ureters, and that bladder. On the right-hand side, we can see an additional little guy on there. He's the kidney stone within that kidney. So it's very helpful in seeing those urinary tract structures. So positioning the patient. We talked about all of these different types of tests, and we talked about how those patients would be positioned to take those tests. So the correct patient position is important for obtaining the best quality radiograph. The type of examination that is necessary determines that patient position. And then some basic views are listed here. I don't need you to be an expert on these different types of tests and the different types of positions. I just want you to be familiar with them, have at least heard these terms before, because you may be sending a patient from your clinic to an x-ray department or a different area, a different testing center to get some of these things done, and you need to be able to speak on it and educate your patient on what they may be expecting. So fluoroscopy. Fluoroscopy is the process of using a fluoroscope to view internal organs and structures of the body so that they can be seen in motion immediately by the radiologist. We actually already talked about this a bit in our upper GI series. We saw that the patient, it was actually being viewed by the radiologist as he was swallowing that barium substance. But what this uses, it uses a monitor and a camera so that the radiographer can watch and take photos of the body system in operation. The patient is usually given a contrast media and placed between the x-ray tube and the fluoroscope. Fluoroscopy is used for procedures such as cardiac catheterizations and for viewing the function of the stomach and intestinal structures. So this picture we have here, that's actually in a cath lab, and they are doing a cardiac cath through that in that picture. Okay, another type of radiological type test is a bone densitometry, and it's an enhanced form of x-ray technology that is used to measure bone loss. And so what they use is, it's also called a dual energy x-ray absorptiometry or bone densitometry. So you'll more commonly hear this called as a DEXA scan. The DEXA machine sends beams of low-dose x-rays with two distinct energy peaks through the bones being examined. So one peak is absorbed mainly by the bone, and the other peak is absorbed by the soft tissue. So the soft tissue amount can be subtracted from the total, and what remains is that total patient's bone mineral density. And this test is used to diagnose osteoporosis. So we'll see here in our picture, we have that DEXA machine, and then we'll have our picture. We can see the bones in that individual's body along with that soft tissue, and there's that program that's going to allow us to find out that total patient's bone mineral density. And again, remember, this is used to diagnose osteoporosis. Okay, another test that you may have heard of before is called a PET scan. Positron emission tomography is the long name of it. PET is a radiographic procedure that uses a computer and a radioactive substance. The radioactive substance is ejected into the patient's body and gives off charged particles. They combine with particles in the patient's body to produce color images that reveal the amount of metabolic activity in an organ or structure. The PET scan can detect cancer and the effects of chemotherapy. Okay, so we can see here on this left-hand side, we have two pictures here. Left-hand side, we see their internal structure. We see their liver, their heart, their lungs. And on the back there, we see a right breast that's normal and then a cancerous breast. This left-hand side one is a CAT scan view. And then on the right-hand side, we see where that's all lit up. That's actually a PET scan view. So we can see where that cancer is identified, and they also can use it to make sure that chemotherapy is being effective. Okay, so a test that is very common nowadays is called computerized tomography, or a CT scan, also known as a CAT scan. CT uses a small amount of radiation. The beams penetrate the body tissues to produce a series of cross-sectional images of the body part being examined. It rotates 360 degrees around the patient to obtain cross-sectional images that are processed by a computer and can be viewed on a monitor and on film. On occasion, a contrast media may be injected for a better view of internal structures. So for CAT scans, you can use it without contrast or with contrast. And the entire body can be scanned in 15 to 20 minutes. So this is why it's often used. It's a great way to see internal body structures. It has a better picture quality than a plain old x-ray. So physicians often opt to use this CT scan. And don't get this confused with an MRI. We see this picture of the machine here. It's more open than an MRI scan, and it doesn't take near as long as an MRI. And we're going to talk more about an MRI in just a few minutes, or just now. So MRIs are magnetic resonance imaging. So an MRI uses radio waves and a large magnet to allow for examination of organs and structures. Images produced by MRI are exceptionally high quality, so this is kind of our gold standard, the best high quality picture we can get of the internal structures. No ionizing radiation is used, and it's non-invasive, safe, and painless procedure that can produce computerized processed images. All body areas can be viewed by MRI, but it is especially useful for soft tissues. It's good for the spine, pelvis, and joints, and it's superior for visualizing the brain and abdominal organs. So it is a great test. Some downsides to it. Some patients that are claustrophobic may have a hard time going through this. It is a smaller tube that you are inserted into. Takes a little bit longer, and there's some loud banging noises as you're inserted into it, so it can kind of frighten some individuals, especially if they're claustrophobic. Okay, so another type of test is ultrasonography or ultrasounds. And ultrasounds use high-frequency sound waves to image or to get images of the internal soft tissues. This procedure can be used to help diagnose problems in the abdominal organs such as the liver, gallbladder, uterus, ovaries, and the spleen. It cannot be used for skeletal structures or for the lungs. Doppler ultrasonography is a non-invasive technique used to evaluate blood flow through the major arteries and veins of the neck, arms, and legs. So a Doppler ultrasound, we can actually see how well the blood is moving through those arteries and veins. An echocardiogram is an ultrasound of the heart and can be used to view the heart and determine its size, shape, and position, and the motion made by the valves opening and closing. So I'm sure a lot of you have heard of ultrasound before and think about when babies are in the womb. They often get ultrasounds to make sure the baby is developing properly, but ultrasounds can be used for lots of other things. So if a patient is suspected to have gallstones, they may have an ultrasound ordered. Again, with the echocardiogram, they may get that ultrasound of the heart, or just that Doppler ultrasound to view that blood flow in their arteries or veins. Okay, so we already talked about the mammogram just a bit, but we're going to go in a little bit more detail. So it's more than other x-rays. The mammogram must be of the highest resolution and contrast. High resolution and contrast call for an increase in exposure to radiation, unfortunately. It's currently safer than ever. So, mammograms are very popular and common nowadays. Only radiography examination fully regulated by the federal government. And then computer-aided detection, CAD, uses the computer to bring suspicious areas on a mammogram to the radiologist's attention. So this is a great test. It saves a lot of women's lives detecting breast cancer. So I cannot speak highly enough about the bounds and strides they've made in mammography. So radiation therapy. Remember we talked about diagnostic radiology, and then we also mentioned radiation therapy. So radiation therapy is generally used to treat tumors that cannot be surgically removed or that are inaccessible for surgical removal, and to treat a malignant tumor that was surgically excised but a portion of the tumor remains. Okay, so basically what we're saying is that radiation can be used in different types of ways to treat types of cancers. So treatments can be either external or internal. External uses direct radiation aimed through the surface of the skin to an area within the body. In contrast, though, internal radiation uses various applications of radioactivity, such as seeds or beads, that are actually planted inside of the body and left there for a certain amount of time. So those radioactive beads or those radioactive seeds are left inside the body to help give that radiation therapy. And the goal of internal or external radiation therapy is to destroy as many of the malignant cells or those cancerous cells as possible without harming the healthy tissues surrounding the malignant cells. Okay, we're going to stop here and I'm going to create one more video just to finish up this PowerPoint. So continue on and watch that last video.